Okay, so what is in your mind before the test that I can possibly help you with?
I'm looking at the scoring for Siwa cows. I know what audit
Okay,
is.
okay, so let's
Can't,
go ahead to Siwa. What about Siwa? What do you do when the score is 8?
well, if it's an 8, I believe you are going to just, 8 is PRN meds.
PRN meds. What are the 2 PRN meds can you give?
That's the stuff I was just looking over. PRNs. So I'm thinking like agitation.
So
I'm
the
thinking
2
of,
PRN meds that you can give, lorazepam or diazepam.
right. And I'll tell you
So
what, I feel
lorazepam,
my expressive aphasia, I that's what I feel like I have. Like if I see it, I'm good at it, but to explain it, I'm not.
yeah, it's okay. So it'll be a lot of explain today because the task it may cause some confusions, right? Some of the answers will be very similar, and that may make you difficult to answer the right answer. So L for lorazepam, you give if it's liver injury because it's shorter half a life.
Shorter, yeah.
So then you give lorazepam, and the D for diazepam you give her if doesn't have liver injury. Just
Okay.
L for love the liver, lorazepam. If someone has a liver compromised, okay.
Okay.
Can you think of 2 or 3 medications that you would give for alcohol abuse?
Okay. So let's see. Um, Ativan.
No, no, for alcohol. Oh, I'm sorry, for alcohol maintenance. That's a better question.
Oh, okay. Um, is it the one with the A?
Accomplished,
Post
okay.
um
Anti-abuse
antabuse.
and
Is it Dispirium? The one with the
o-
D?
okay. You can say Vivitrol if it's the injection or naltrexone.
Okay.
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 All right. So that's SIWA, right, for alcohol. Then you
Hmm.
have COWS for
Or opiates.
opioids. But actually, go back to SIWA for a minute. So if the score is 15, how do you manage those with alcohol use disorder?
Scheduled meds and PRN.
Okay, schedule meds and PRN. Great. All right. Now, in regards to all scales, when the score is high, what's your priority?
The score is high.
Yeah, let's say,
Yeah.
if you assess information depressive disorder and now you giving a medication, but now the patient comes back with a high score, what is your priority at the time?
Besides treatment and monitoring.
Yeah, so basically I'm trying to allude you to if the score is high, it's not medication, it's not treatment anymore. Oh, it's only one priority. It's assessment for suicidality.
Okay. Assessment.
For suicidality.
And I knew that. See, it's like I know that, but it doesn't come out. Okay.
Yeah, no worries, no worries. It's going to be a lot of pressure today, right? Because we're rapid firing things here. So don't, just try first thing that comes to mind, try to speak of it. But yeah, it's not easy to just blurt things out, right? So
Right.
so just it's going to be a little bit of uncomfortable here, but Let me just get a few things here ready. All right. When it comes to cows, how when do you start the treatment? What number?
This was the stuff I was just going over. Um, I'm not quite sure. So the numbers, that's what I was just looking at.
So a 5, right?
Okay.
5. You can start the treatment for cows, right?
Treatment.
And what medication would you give?
I always think anxiety with cows.
Yeah, cows is for opioids, right? Sure,
So,
you could think about anxiety, but
okay.
think of clonidine, which is a blood pressure medication, right?
Yep.
Essentially. So clonidine, when the score gets to 13, then you can give 2 other medication. What would that be?
I'm not sure, Doc. I'm not sure.
No worries, no worries. Suboxone or naltrexone.
Yep.
Okay, no worries. No worries. Is this the first time you're testing?
Yes.
Okay, all right. So let's think of this way. First time you test, even if you don't do well, it's okay, all right? It's just the second time you cannot afford to mess it up,
Mm-hmm.
okay? And the reason is that those that have not succeeded the first and the second time, they are very unlikely to pass the third time. Okay, so as you walk there, be a free spirit. Is the as you've done what you could with what you had in your hands, maybe some family issues, maybe some work issues, and things like that got on the way. So regardless of the outcome, is not all over. Okay, so it's just that if we don't get a positive outcome, you just need to the second time take it very very hard because we don't have a third chance.
Mm-hmm. Okay.
Okay. That being said, when it comes to when it comes to um, questions, you will find a lot of questions that you don't remember, and you're like, "What is this?" It's okay. Most of the questions that you don't see, or you haven't covered, or you never heard of, it's likely to be a throwout questions. If you haven't heard, others haven't heard it either. So don't panic.
Okay.
Don't panic. Work each question to the best of ability as you move from 1 to 2 to 3 to 4, and minimum strike through 2 of the answers so that you have only 2 possible answers, and then
Mm-hmm.
you save the question. At the
Okay.
end, before you submit, you will have opportunity to review those 5, 10, 15 questions. But now, when you come back to those questions, know that um, now you eliminated 2 answers already. You only now have to pick between whatever the 2 possible answers. So make it a little bit easier as you come back to those questions that you saved. You will encounter questions that you never heard of, and that's okay. As long as you don't panic, and you keep work through it about a minute and 20 seconds per question. If you find yourself spending 2 minutes in a question, don't do it. Give it up because you are stuck on the question and you may lose time on an answer that you could possibly get it right. So if you feel yourself stuck, eliminate 2 answer choices, save the questions, move on. Okay, because that
Got it.
way, if you have time, you come back to it. If you don't, you probably didn't know the question anyway, so your chances of getting it right would have been very,
Yeah.
very difficult. Okay. Now, have you had the chance to really look through the documents that I sent you?
I breezed through them yesterday, and right now I'm up to page, I think, 50. I'm
Okay.
up to page
All right.
50, so I'm just doing the Siwa and the cows and that type of stuff.
Okay. So, what is cultural syndrome?
What is culture syndrome? It has to
Hmm.
deal with a how would I say it? It is um norms for that culture and that community.
Okay.
So
Okay.
they could be
So, that
different
being
than
said, yeah, you're absolutely right. I just want to kind of like, because we have a lot to cover, so I may have to
Mhm.
cut you off every once in a
Yeah.
while, and I apologize for that.
Okay.
But now, if that's normal for the culture, is not a mental order condition, right? Even though it might be weird. If I say that in my culture, I wake up at 4 in the morning, go for a run, you cannot call it insomnia, for example. That's normal in my culture. So it's not a a mental health condition.
Mhm.
Now, if you encounter something that's culturally related, how do you answer those questions?
Um, I would ask them, how do you deal with that in your culture?
Perfect. Okay. Teach me how, help me better understand. So don't give a scientific answer. This would cause an
Right.
infection, or I think it better to get labs because this is, it's going to be a problem. Now, in regards to culture, what does susto means?
Um, fright.
Okay, perfect. All right. Um, how about ataque de nervios? Nervios is a Puerto Rican
Like
syndrome.
a attack of the nerves.
Okay. Do you know mal de ojo? Evil eye.
Um, the evil. Yes, it's the evil eye, but I forgot how to describe that one.
Okay. Just just think of a flu-like symptom. Well,
Mm,
fatigue, headache, weight lose, exhaustion, malaise,
yep.
things along those lines. Uh, there's this, I don't know if it's super high yield, but something called molera caída, sunken funnel. Do you remember that?
Mhm. Yes, the
What
front.
does wind cold
I
means?
think of chills. I
Chills.
think of
Okay,
chills.
illness concept in a traditional Chinese medicine or TCM that describes a patterns association with the invasion of the body by external pathogenic factor, particular wind and cold.
Mhm.
Okay, that's high yield. Please know that.
Okay.
Um, so let's see. Can you describe apoptosis?
Doses of.
Has to do with the cell.
Oh, I didn't hear the word. It's kind of like like a destruction of them.
Yeah. So cell death. Okay.
Mhm.
Now, when you're dealing with thyroid, what's a regular thyroid value?
0.5 to 1.5.
Okay, so the thyroid stimulating hormone, the TSH,
Mhm.
0.5 to,
1.5. Wait, what am I answering wrong then?
I'm sorry. So the thyroid stimulating hormone, the TSH, is 0.5 to 5.
The 5, and I'm saying 1.5. Yep, I got it. Yep.
All right. So when the T3 and T4 are high and
Mhm.
the TSH is low, what condition would that be?
Hyperthyroidism.
Perfect. When the T3, T4 is low and your TSH is high, what would that be?
Hypothyroidism.
Okay, perfect. Hypo. What hypothyroidism looks like? Give me the symptoms.
Oh, you could be cold, agitated.
Perfect. Oh, it'll be cold, it'll be lethargic, more like
Lethargic.
everything is
Yeah,
slow.
lethargic.
Okay,
So everything
perfect.
just kind of slows down.
Yes. Now, Depakote, what kind of birth defect could that cause?
Neural tube.
Okay, all right. Giving two FDA warnings for Depakote.
Black box warnings for Depakote are the neural tube defects.
Well, FDA warnings for the medication in regards to hepatotoxicity and pancreatitis.
Yep. Yep.
Okay. All right. So, in any conditions that you find to be toxicity, what would be your first action?
Usually you're going to DC the med.
Okay, perfect. All right. Okay. Do you happen to remember what would be a normal therapeutic volume for Depakote?
It's 0.6 to 1.2.
0.6 to 1.2 would be lithium.
Lithium. So Depakote. Oh crap. Yeah. I mean, if I see it, I'd know it.
Okay. 50 to 125, right?
Oh,
Uh,
yep. Wrote that how
okay.
many times?
Yeah, no worries. Um, do you would you be able to describe what pancreatitis signs and symptoms would look like?
Um, upper abdominal pain that radiates to the back
Perfect.
is the one that
Okay.
sticks out for me.
Yes. No, that's actually perfect. And oily stew. Okay,
Mm-hmm.
very graphic. Oily stew.
Okay.
Okay, pancreatitis. Now, when it comes to kava kava, can you think of any medication that you've not mixed kava with?
Uh, benzos.
Benzo, perfect. What would you give kava to what condition?
Anxiety.
Anxiety, okay, perfect. What kind of symptoms could cause a damage to the body? What body
Liver.
organ?
Liver.
Liver. Okay, okay. So definitely do not mix with alcohol, right?
Stop it before surgery.
Stop it before surgery. Perfect. Okay. Can you remember of any vitamins that could help with depression?
Is it St. John's wort?
Sure, that would be a one. But I was thinking more B12, B16, and
Oh, yeah, yeah.
omega fatty acid. But you are absolutely right as well. Um, can you think of some antipsychotic medication, first generation or second generation, that could cause a QT prolongation?
Antipsychotic medications. Is it olanzapine?
Uh, yeah, that would be less likely to cause QT prolongation. But haloperidol,
Hold on.
quetiapine, and ziprasidone.
Got it.
Okay. Uh, if you find a patient are in a lot of meds, or patient that's taking a constant medications for cancers, can you think of an SSRI that you'd prescribe?
I remember seeing it. Answer.
Lexapro, Lexapro.
And that's what I was gonna say. See what I mean?
Okay,
It's like I know it, I just can't spit it out.
okay, because you're more likely to find Prozac as a possible answer. You're likely to find Zoloft as a possible answer. Pick Lexapro.
Mhm.
Okay. Um, can you think of two antipsychotics that are most weight gaining?
Weight gainers. So I know it's a lot. It's not one. Okay, is it the one with the Z?
Um, it could, but the
Um,
two that's very known to cause weight gain.
Is it lithium?
No, antipsychotics.
Antipsychotics. So no, not at the moment.
Okay, olanzapine,
Mhm.
olanzapine, and clozapine, but specifically olanzapine.
Okay.
Okay.
Yep.
What is different about second generation's antipsychotics compared to the first generation? How are they different?
That one I can't answer.
Okay. The second generation has a 5-8-2T,
Okay.
right? So it's the serotonergic
Mm,
added to it compared to the first generation.
okay.
Okay. All right. Yeah. So because of the extra serotonin, it causes less meta. No, it causes less EPS symptoms, but it gives you more of what?
Okay. So less. And I know this. I know this.
It's okay.
Go ahead.
So it causes more metabolic syndrome, right? Second generation, more metabolic syndrome,
Mhm.
but less EPS.
Yes. Okay. Okay.
Okay. So one quick second here. Okay. Let me give me a quick second because I have to set up my
Sure.
alarm here. One second, please. Be right back.
Okay.
All right. Sorry about that. I have another meeting 6:30 in the morning here with my time.
Okay.
So, right. So, can you describe what metabolic syndrome is?
Gosh. And I'm gonna keep apologizing. If I see it, I know it. I just can't explain it.
Yeah, I think the problem is that the tests, all the answers will look alike. Okay, so if you, a lot of people say they kind of know, but the test will be challenging.
Okay.
Okay, so it'll be very easy to miss questions that you even know them because of that. So, what is discontinuation syndrome?
Okay, so you just abruptly stop the meds.
Yes,
Believe that gives you metabolic syndrome, and you treat it by starting them back on the dose they were on.
perfect. If you prescribe lamotrigine, what will be your main side effect that you'd be most concerned of?
Lamotrigine. Okay, I know that's the safest in weight gain. Steven
Right.
Johnson syndrome.
Okay. Now, can you think of another medication that could cause Steven Johnson syndrome?
Isn't it tramadol?
Mm,
I think I wrote that
well,
somewhere.
yeah, tramadol too. You are right about that. Very good one. Okay, but it wasn't the one that I was mainly concerned of. But tramadol is one of them, so that's very good.
That is the other one that can cause it. Not sure.
Carbamazepine.
Say that again.
Carbamazepine.
Okay.
Okay. So how do you pick between carbamazepine and lamotrigine if the question is concerning about Stephen Jones syndrome? You're going to have an answer that's lamotrigine and carbamazepine. How would
Okay.
you pick your answer?
So, I mean, I know what the symptoms are,
Mm,
but
Not necessarily. I'm talking about a population that you pick one versus
oh,
the
the Asian population.
okay. So the Asian population, you would pick which medication?
The I believe it's the carbamazepine.
Yes, perfect. Carbamazepine. So if it doesn't, the question doesn't say Asian population, then you pick lamotrigine.
Right.
Okay. Uh, so what are the metabolic syndromes labs that you would be concerned about?
Let's see. Um, just say that again.
What is metabolic syndrome? It would be defined by what? What labs would you look at it and be like, okay, these are sign of metabolic syndrome? Remember,
Yeah.
metabolic syndrome is related to second generation
Mhm.
medication, antipsychotics.
So, um, LFTs.
Okay,
Mm, I
but
can.
it's more related to lipids, panel,
Right. That was the
triglyceride.
next thing I was going to say is lipids.
Okay. Do you remember anything else? What else would go up?
Mm. Is it the AST and ALT?
No, not necessarily, because there'll be AST and ALT will be indicative of liver damage, right?
Right.
So metabolic syndrome is a group of labs and measurements that we see that's related to weight gain. That being said, you would expect your BMI to be increased, your
Okay.
glucose to go up,
Mm-hmm.
your lipid panels to go up, lipid panels, triglyceride, things of that
Yes.
nature.
Yeah. Mm-hmm.
And what would be the number one indicative of metabolic syndrome? What would be the first sign to show up?
I'm not sure, Doc. I'm not sure.
No problem. It's a hip to waist ratio.
Oh, I know that. It's yeah.
It's okay. All right. It's not easy because we just you probably had a long day. Uh I'm just trying to kind of bring the questions up in your memory, okay? So it's normal to be nervous, okay? If you have someone that's stable on the antipsychotics and everything is going well, but they happen to have metabolic syndrome, or signs of weight gain, increase, um, hip to waist ratio, for example, which
Mhm.
is the first sign. How would you manage those patients?
I would recommend lifestyle changes like diet,
Perfect.
exercise.
Excellent. So you do not change the medication, you do not increase or decrease. You do exactly what you said. Lifestyle changes. Okay. Very good. Um, okay. Let me just see. Do you remember the two FDA warnings for carbamazepine or tegretol?
Is it I'll probably say it wrong. The A granulitis and the aplastic anemia.
Perfect. So agranulocytosis and aplastic anemia. So perfect. So what is agranulocytosis?
Okay, so that is when the white blood cells are decreasing, they're at a risk for infection.
Perfect. Very good. So that's a very important point. So let's say your ANC is less than 1,000. What do you do?
You would discontinue the med,
Okay, let's say the ANC is more than 1,000, but someone has a sore throat. What do you do?
monitor the symptoms.
No, you
No,
discontinue
you're gonna
because you discontinue any signs of infection.
infection. Yep, yep.
Despite of ANC, you discontinue the medication. Okay, so you said that the second FDA warnings for carbamazepine or Targetol is aplastic anemia. What does it look like?
Um, pallor. You may have bleeding gums.
Okay, perfect. Excellent. So headache, fatigue, nosebleed, but specifically
Mhm.
what you said, bleeding of the gums, skin rashes, sometimes even shortness of breath. Okay. Now, remember that carbamazepine could also cause what?
Isn't it liver toxicity?
Yeah,
No.
yeah, that's part of that, but the wasn't I was looking for. Steven Johnson syndrome,
Yep.
right? For
Yep.
Asian.
Right.
How would you screen the Asian population
Oh,
for
it is. I know that
COVID,
that test, the
right? You're right.
H
H
H
lab,
H lab.
H
That's right.
lab, H
1502.
lab 1502, right? So it's highly associated with carbamazepine-induced Steven Johnson syndrome. Okay. All right. So, what is the other medication? We talked about carbamazepine, and what's the other medication that could cause agranulocytosis?
Mm, I think It's not clonidine.
Clozaril.
Well, it's a real. Okay.
Clozaril. Okay. All right. So if the white blood count is less than 3,000, okay,
Mm-hmm.
you also discontinue clozaril or carbamazepine. Okay. So as far as lithium, you mentioned before, what is the regular lithium volume?
The 50 to 125. Oh wait, lithium. Jeez.
It's okay. It's normal.
Uh,
I'm asking questions. They're random. Just to jog your memory. It's fine. You answered
the
this before.
0.6 to 1.2.
Perfect. Okay. Now, if the lab is 1.3, what do you do?
With no symptoms monitor.
Perfect. Well done. If the lab is above 1.5, what do you do?
You have to DC the medication.
Perfect. You DC the meds. Very good. Okay. And lithium is the gold standard for what
Mhm.
type of psychiatric condition?
Bipolar.
Perfect. Manic bipolar. Well
Manic.
done. Yeah, you're right. Bipolar, manic, right? Specifically. Now, which medication has a anti-suicidal effect for
Oh,
those with manic population?
isn't it lithium?
Perfect, lithium. Okay, which medication has a somewhat anti-suicidal for those with schizophrenia?
I can't say it off the top of my head.
No problem. Clozaril,
Oh, that's all right.
okay? And if it's manic or bipolar, then it'll be lithium.
Lithium.
These are the two medications that could prevent, uh, are known to be a little bit better than others, anti-suicidal effects.
Right.
Okay, so if it's schizophrenia, you pick clozaril. If it's manic or bipolar patients, you pick lithium.
Lithium.
Okay. Now, since we're talking about suicidality, which psychiatric condition comes to mind that will be at the most at risk for suicidality?
Schizophrenia.
Perfect. Schizophrenia. Well done. Okay. Very good. Um, okay. Now, if you have someone with a kidney injury, let's
Mhm.
say with protein and urine, the 3 plus, 4 plus,
Mhm.
what medication would you be most concerned with to prescribe? Well, not what medication, but can you think of one that you'll be concerned with? Lithium, right?
It's there. It's literally right there. Yep.
But it does not mean that you need to stop the medication.
I'm gonna monitor.
You just need to monitor, okay? So it's not like, oh my God, I have to stop. Okay? It doesn't mean that. All right. When answers that involved uh, HCG, generally speaking, right? I don't know that. Generally speaking, if the answer involved HCG, likely it could be possible answer because that's safety.
Okay.
Now, your pregnancy test, the HCG, what age would you give it? Females would most likely
Is it
applicable
like,
to HCG.
was it 1654?
As early as 12 to 50s.
Cool. Okay.
Okay. Can you tell me some side effect of lithium?
Some side effects of lithium. Dry mouth.
Sure, because it causes dehydration.
Right. So dehydration. That's about where I'm at.
Okay. Hypothyroidism,
Yep.
fine hand
Yep.
tremors, fine
Right.
hand.
Yep.
Because if it's coarse, then it would be what?
It'd be NMS.
No. So NMS can only be caused by antipsychotics.
So where is my mind going?
So
Okay.
hypothyroidism. Now
Mhm.
we're talking about two symptoms of lithium. One is a side effect, and another one means toxicity. If it's
Mhm.
fine in tremors, it means a side effect because you cannot see it, right? The patient can tell you it's tremoring, but you can't see it. If it's
Mhm.
fine. Now, if it's coarse, you can see it. In
Right.
that case, would be indicative of toxicity. It's not no longer a side effect to be a toxicity level.
Got it.
Okay. So, side effect of lithiums, you think of a fine hand tremors, maculopapular rash, GI symptoms, diarrhea, vomiting, cramps,
Yep.
anorexia, diabetes insipidus,
Mm-hmm.
like polyuria, polydipsia,
Yep. Mm-hmm.
EKG changes, like a T wave inversion, and leukocytosis. What is leukocytosis?
Is that the decrease of leukocytes?
Increase of white
It's
blood
in.
cell.
Yep.
Okay? All right. Because, yeah, so uh, lithium can cause which type of birth defects?
Lithium doesn't
Mm-hmm.
that cause the Epstein's anomaly?
Perfect. Yes, perfect. Now, think about this because bipolar is very much familial, come in the history of the
Mm-hmm.
family, right?
Mm-hmm.
And you get a patient who has a heart murmur, then you would say things like, has your mother taken lithium while
Mm-hmm.
pregnant with you, right?
Mm-hmm.
Because it's like you understand that lithium could cause, it's unlikely that the test asks you which of the following would most likely to cause cardiac abnormality, right? And give you lithium as the answer. It's going to, that's rogue memorization. Now it's application. Questions like, has your mother taken lithium while pregnant with you? Or things along those lines would be more applicable application, right? So that's what the test is looking for. Are you able to apply the knowledge rather than rogue um, memorization, right? So lithium, would you be concerned with liver or kidney damage?
I think liver.
So
You like
we
it
said
wrong.
that a 4 plus protein in the
Oh,
urine,
protein. Right. And that affects the kidneys.
okay,
The
so
Yeah.
it's kidney related, okay, all right.
Got it.
Now, that being said, can you think of any medication that could increase lithium levels?
I NSAIDs.
Perfect. Very good one. What else?
Antibiotics.
Sure. Yes. Antibiotics get good too. But things like anti-gout medication.
Oh, yeah, yeah.
That could be one, but I love that you said NSAIDs, NSAID, ibuprofen, um, thiazides, right? Any blood medication for blood pressure. Because
Mm-hmm.
think about it, blood pressure affects the kidney, right? So any medication that's working the kidney could potentially to increase lithium levels, right? Now, one specifically is called ACE inhibitors, okay,
Yes.
like lisinoprils,
Mm-hmm.
right? Um, what else can ACE inhibitors medication be used for?
You mean besides your heart?
Perfect. This is what I
Okay.
want.
Okay.
Heart failure.
Right.
Perfect. Well done. Okay. Um, hyponatremia or low sodium level. Can you remember what's a regular sodium level looks like? A normal?
I want to say 30. I don't know. I always get this wrong. 35 to, is it like 40 or 45?
Perfect. I mean, 135 to 145, right? So just think 35, 45, just put on one in the front, 135 to
Mm-hmm.
145. It's just 10 more, right? Make it easy. So hyponatremia can increase or decrease sodium levels. Hyponatremia
So for
can
me,
increase.
hypo is low.
Mhm. Hyponatremia is low sodium, but would that increase or decrease lithium's levels?
It increases it.
It
It's the opposite then.
it increases sodium's level, right? So it reduces lithium clearance. So less lithium is screened
Right.
out. So therefore increases lithium level. Okay.
Hmm?
Can you tell me what addiction is?
Addiction is when you will do anything possible to get your drug of choice.
Perfect. What's dependency?
Like dependency, an example would be like you get up in the morning, you have to have a drink. Like
Perfect.
your
Okay.
body,
So
your body
yes,
wants it.
yes. Sorry, sometimes I'll have to cut you off because we got quite a few things. But if I see that you got it, I just
You
want
got it.
to
Okay.
keep on moving. Okay. I'm not trying to be rude by any means, but I
You're
just
not
want to get
rude. I know you're not.
possible with you. Okay. As much I can give you as much as possible
Mhm.
time and knowledge here. Now we're talking about addiction. Can you tell me of two neurotransmitters that would pop right away to your mind when it comes to addiction?
I went over these today. So two neurotransmitter isn't any addiction. Is it GABA?
Yes. And dope.
Dopamine. Yep. Yep.
Yeah. Dope and GABA. Okay. Now, I want you to know that there are several neurotransmitters that are involved with nightmare, but number one is not norepinephrine; it is serotonin.
Mm-hmm.
Okay, it's weird. Okay, and they could explain this in different ways, but just remember that serotonin has a lot to do with nightmare.
Nightmares. Okay.
Okay. Um, let's see. Can you think of the neurotransmitter involved with mood disorders?
Okay. I think how did I do? What did I do? I do this. So mood is, let's see, DNS, serotonin, norepinephrine, dopamine, norepinephrine, serotonin.
Perfect. Okay, so I should have been more specific. Okay,
Okay.
so if I ask you which neurotransmitters are involved with major depressive disorder, you say dopamine, serotonin, norepinephrine.
Right.
Okay, but I kind of ask you a difficult question. I ask about mood disorder, right? So that case would be kind of like almost all of them. So be norepinephrine, dopamine, serotonin, GABA, and glutamate.
GABA and glutamate. Yeah.
Okay.
DNS.
Now let's go back to this bucket of serotonin, norepinephrine, and dopamine. So it is major depressive disorder. Now,
Mhm.
can you think of two conditions that would fall under that bucket of serotonin, norepinephrine, and the dopamine? One is major depressive disorder. The other would be
Um, no, it's not ADHD.
perfect. Yes, well done. Now, one more.
Oh,
So we have dopamine, serotonin, norepinephrine for major depressive disorder, ADHD, and we have one more condition, psychiatric condition that dopamine, norepinephrine, serotonin usually are the main neurotransmitters involved. Can you remember it?
it's not OCD, is it?
Well, close, but it has ticks.
Oh, Tourette's.
Tourette's. Okay, so it's very close to OCD, right? Because OCD too. So that brings me another good point. If you see ticks, don't jump right away into Tourette's. It could be OCD.
Right.
Okay, so be
Mhm.
careful just to see ticks. Now, earlier you mentioned NMS. What type of medications can cause NMS? So it's neuroleptic malignant syndrome. There's only one, well, I wouldn't say only, mainly one class of medication. What that class would be?
Um, is it the SSRIs?
No. SSRI could cause serotonin
Yeah, syndrome.
syndrome. NMS, it's kind of almost opposite to serotonin. Not really, but for the test, we are comparing these two conditions, how they are similar and how they are different. They're not opposed to each other, but for the test purpose only, we kind of really need to know how they are alike and how they are different.
Mm-hmm.
NMS mainly caused by antipsychotics.
Yep.
Serotonin syndrome is caused by serotonergic
Mhm.
meds. NMS shows up or give me some symptoms related to NMS. Can you remember a few?
The coarse hand tremors.
Well, hold on. That's
How did
lithium toxicity.
I write this? I did write it down.
Very specific.
Right.
NMS, we're looking for the muscles are so rigid, they call lead pipe rigidity.
Mm-hmm.
Mutism,
Yeah.
elevated CPK
Yes.
because of the muscles contraction, right? If you break it down, your muscles are
Right.
tremoring,
Mm-hmm.
you'd have a CPK elevated,
Mm-hmm.
which is nothing but it is a lab that we see for muscle contractions, right? Destructions.
Right. Mm-hmm.
A myoglobinuria, right?
Mm-hmm.
So resulting because of the breakdowns of the cells, which would cause rhabdomyolysis.
Mm-hmm.
So, few things to remember about NMS: muscle rigidity,
Mm-hmm.
mutism, elevated CPK,
Mm-hmm.
and myoglobinuria, which is the muscles breakdown, which is similar to or
Mm-hmm.
will eventually lead to rhabdomyolysis. There are more things, but these are how they are different than serotonin syndrome. Okay.
Yes.
So in that case, let's say you have someone with NMS, which is neuroleptic malignant syndrome. What
Mm-hmm.
are the two medications of choice you would use to treat it?
I think muscle rigidity, and I think cogen. I
Okay.
don't think that's what's used here.
No. So that is for EPS symptoms, right? If you
Yes.
looking for
Okay.
Jensen, here we're talking about NMS. So we're looking at the called the then
Yep.
bromocriptine and
I know
dantrolene.
that. Yes. For the muscle
Now, it's
rigidity.
likely that the question could ask you, give you symptoms and say which one you would use and how would you select dantrolene? For what kind of symptoms would you
The
select
muscle,
dantrolene?
the much muscle rigidity.
Perfect. Yes, muscle rigidity. And what kind of class of medication would bromocriptine be?
I don't know. I
Okay,
do not
so
know.
let's break this down. We have NMS.
Right.
NMS is caused by what type of medication? A class of medication. Is it
Antipsychotic.
serotonin?
Uh, no, the
Okay, so what would
antipsychotic.
that be? Antipsychotics. Okay, antipsychotics. What would be another name for antipsychotics? Would be a dopamine antagonistic or agonistic?
It's is it the agonist? No.
So antipsychotics are known for their dopamine antagonistic.
Antagonist.
Okay, and because we give generally speaking, a dopamine antagonistic, patients could develop NMS.
Right. Okay.
And in order for us to reverse that, we have to give a D2 agonistic or
Agonist.
antagonistic.
So we'd have to give the
The problem
agonist.
was caused by antagonistic, a dopamine antagonistic, antipsychotics. We want to reverse that, then we would give a D2
Agonist.
agonistic.
Mhm.
Right. And that would be bromocriptine.
Okay.
Do you understand the rationale
Yes.
or no? Because the problem was caused by D2 antagonistic.
Okay.
Now we
Right.
have to give a D2 agonistic. Got it?
Yes.
So dantrolene for muscle relaxant, D2 agonistic for bromocriptine.
Mhm.
Okay. And obviously, with NMS, we want to be on a watch out for liver conditions, leukocytosis, as I mentioned, elevated white blood count, right? Now, there's going to be catchy here. Can you remember the four main symptoms that I just described to you that is NMS specific?
You have the muscle rigidity, the mutism, the elevated CKP
CPK.
and the
Yes.
myoglobular.
Yes. Myoglobinuria. Perfect.
Right.
Okay. So remember, and the two medications that we can give,
Dantrolene for muscle
and
rigidity. And the bro one, because it's a
perfect.
D2 agonist.
Perfect. Excellent. Now let's see how is that different than in serotonin syndrome. So serotonin syndrome is caused by what type of medication?
Serotonergic
Okay,
SSRI.
antidepressant. Perfect.
Mhm.
Now you'd have, I'm going to give you four things. Well, let's say maybe a little bit more than four. But hyperflexia, so your
Right.
joints are super flexible.
Then you have the jerks.
Myoclonic jerk, myoclonic jerk,
Mhm.
myoclonic jerk. So type of a seizure-like movement, right? Then you would have your vital signs will be all elevated, like a
Mhm.
rapid heart rate, elevated blood pressure, headaches, and sweating shivers. Okay, but
Mhm.
specifically, I want you to remember two things:
Okay.
hyperflexia and
Mhm.
myoclonic jerk.
Right. Okay.
Okay, so because and seizures, right? Because that would be different than NMS. A lot of things they share commonalities, but I'm trying to cram down here for before the test the things that are very specific. Now, if for NMS you call the bro then bromocriptine and dantrolene, who would you? What kind of medication would you bring in for serotonin syndrome?
Okay. I call it wrong, but I call it crypto.
Yeah,
It's
okay. Cryptoheptadine, whatever you want to call it, as long as you remember for the task that at this moment it's what matters, right? We need to call it proper. We're medical professionals that are we really want to be recognized for how we use our terminology, but right now it's
right.
about you in the task, so I don't care how you call it as long as you remember. Okay? All right. Now let's talk about this. When and how to switch medications between SSRI, SNRI, TCA, MAOIs. How long do you have to wait between discontinuing a SSRI to a TCA?
Oh, a TCA. Is that the one that is 5 weeks? If not, then
No,
it's 2 weeks.
2 weeks. The one that's 5 weeks is
It's the
Prozac because Prozac has a longer half-life,
life.
like about 5 weeks. Anything to anything like SSRIs, SNRIs, TCA, MAOIs would be at 2 weeks.
2 weeks.
Prozac to any of those four classes, 5 weeks. Any of
Five
those
weeks.
four classes to Prozac's 2 weeks.
Okay.
It's just a Prozac to any of the other classes, 5 weeks.
5 weeks.
Okay. All right. Um. So now that being said, if you are ordering a medication and let's say someone comes to you and the PHQ-9 is 14 and you prescribe Lexapro and you said, hey, come back in 4 weeks. And now the person comes back after 4 weeks and you prescribe 10 milligrams of Lexapro. The person comes back 4 weeks later, now the PHQ-9 is 3. What would be your next action? To decrease the medication, increase the medication, make no changes, or switch your medication.
Make no change.
Makes no change. Perfect. Why would that be?
Well, you're already showing improvement and you don't want to take them off of a medication too soon because they could relapse. So you want to, my rule of thumb was always a year, but I think it's 6 months to a year.
Perfect. You mostly correct, but I'm just emphasize the point that you make no changes for 6 to 8 weeks. But you are absolutely right. 9 months to 12 months is when you should be on the medication, and after that, we try to decrease the dose and see if they could be without the medication. Absolutely right. Okay. Now, medications like triptans, sumatriptans, they are effective to in treating what type of medical conditions?
Migraines.
Migraines, but they also could cause, if used without a certain urge of medication, what kind of condition?
Ugh. I knew it, I'd see it, but can't recall.
Serotonin syndrome, right?
Oh, yep.
Okay.
Yep.
All right. Can you remember what brain parts? Well, this is kind of tricky question here, but like in depression, your amygdala usually will be enlarged, hippocampus and thalamus are reduced. Kind of just
Mhm.
general rule of thumb. Now, remember, patients on medications that are for cancer, like tamoxifen, you
Mhm.
would give which SSRI?
Gosh, is it Lexapro?
Perfect, because it has the least drug to drug interaction. Okay.
Interactions. Right.
All right. So if you think about patients in pain and you want to use a serotonergic medication, what kind of class of medication would you pick?
Is that a TCA?
It could. It's not wrong. It's not wrong. Okay. But it's primarily a SNRI.
It's SNRI like duloxetine.
Yes. And the only reason is because it's caused less cardiac
Less
complications
cardiac.
compared to CCA.
Okay,
Okay.
got it.
So that is another point I want you to remember. I'm sorry my camera went out. I don't know why. Um, my apologies here.
Worries.
Why would that be? So that brings another point. Why would you prescribe a SSRI instead of a TCA?
Hmm. You said an SSRI instead of a TCA?
Yeah. Why SSRI would be the main medication, a go-to medication for the first time you're treating someone with major depressive disorder instead of a TCA or MAOIs or any other class?
I like fluoxetine.
Yeah, but specifically for the test, we're teaching for the test, not so much for practice. But for the test, I want you to remember it is less likely to cause damage in case of overdose.
Oh, okay. Um, I don't remember which one.
Okay, so SSRIs are less likely to cause damage in case of overdose. Okay, my
Oh,
apologies.
you didn't want a specific one, just an
No, the
SSRI.
class.
Okay,
Just
got
because
you. Okay.
PCAs are more effective than SSRI,
Yes. Yes.
right? Generally speaking, but it comes with more side effects. But specifically, if you if your patient takes a bottle of TCA compared to a bottle of
Mhm.
SSRI, they're likely to have cardiac complications with TCA and not so much or not as much with an SSRI. Again, this is
Gotcha.
general principle for the
Mhm.
test only, right? It doesn't necessarily apply for real life and things like that, right? You have to use your clinical judgment for real life.
Right.
But for pain management, medication like duloxetine,
Yes.
venlafaxine
Then that's
are
right.
good choices for pain management,
Right.
muscular
Mhm.
pain management. Okay. Um, Wellbutrin. How to what kind of patients would you prescribe Wellbutrin to?
Um, Kind of like ones with fatigue. I know you would avoid those with that has a head injury or epilepsy.
Okay, perfect. So Wellbutrin would be a good choice for those with fatigue
Mhm.
like,
Yep.
okay, fatigue like conditions, right? Now, for when you prescribe an SSRI, what would be the main side effect that you would warn the patients, specifically males?
Sexual side effects.
Okay. Can you think of two medications that would cause least sexual dysfunction or less likely to cause sexual dysfunction?
When it comes to SSRIs or in general?
Antidepressants.
Antidepressants. Side effects. I remember seeing it, but I don't remember.
Wellbutrin
Oh, well, yeah.
and
Yeah.
mirtazapine or Remeron,
Remember. That's right.
okay, and Wellbutrin.
Hmm.
So if the patient is concerned about sexual side effect, then perhaps Wellbutrin would be a good choice.
Right.
Okay, and yes, you want to avoiding with seizure disorders, anorexia and bulimia and things like that.
Yep. Hmm.
Okay, okay. Let's see other things that I wanted to. Which psychiatric condition would you be most concerned with homicidal ideation?
Um, Not the avoidant personality.
Antisocial personality disorder, right?
Antisocial.
Other things could be also schizoaffective, borderlines, but antisocial personality disorder would be the main one, right?
Right. Hmm.
If I say how patients with schizophrenia, they'll have a hard time with abstract thinking.
Right. Hmm.
Can you think of an example of abstract thinking?
Um, so I know they don't have concrete thinking when I think of abstraction. Um, I don't know, like their thought process is just kind of it's not together, it's
Okay,
disorganized.
okay. So things like if you live in a glass house,
Mhm.
you wouldn't throw rocks. That's
Right. Okay.
abstract. Okay. All right, that's my alarm. Can you think of the age breakthrough of schizophrenia for males?
Males is like 18 to 25, and then women is 25 to
35.
30. I want to say 34. I don't know why.
Yeah, 35.
Okay.
Okay, at this time I have to go.
Yes.
Uh, I uh, I have a meeting now in the next 10 minutes with somebody else.
Okay.
If you think this is can be beneficial, I can meet again for another hour with you after this meeting. Otherwise, um, we can,